Hi, I'm Dr. Brandi Cole and I'm a pharmacist here at Persona Nutrition. And today we're going to talk a little bit about how drugs and supplements and nutrients are absorbed inside of our bodies. If you've ever asked your doctor or your pharmacist when picking up a prescription, should I take this medication with food? Then you've actually asked a question about drug absorption, whether you realized it or not. The way that a drug, a supplement, or a nutrient gets from inside of our stomach to our bloodstream talks about drug absorption. We want to make sure that we're getting the most out of our medication so it can go throughout our body and work where it's intended. And there's really three main things that we can look at when looking at drug absorption. Three factors that may change it. The first being the acid level in our stomach, or gastric pH. So most drugs, supplements, and nutrients alike like a certain level of acid in order to do their work in our stomach and get into our bloodstream. If we raise that level of acid by eating or drinking something acidic, think orange juice, then that can change that absorption. The same happens if we lower the level of stomach acid. Think taking an over-the-counter antacid to treat common heartburn. Changing that level of acid in our stomach can change the way certain drugs, supplements, and nutrients get into our bloodstream. Another way that absorption is changed is by food. Some drugs and some vitamins like to be taken with a fatty meal to increase their absorption. Think fat-soluble vitamins. Taking those types of drugs and supplements or multivitamins with food can increase their absorption. And as a bonus, sometimes it helps with side effects like gastric upset or GI upset. Another thing that we need to think about when looking at absorption of drugs and supplements is if they interact with one another. So some drugs like to bind together with certain nutrients when they're in the stomach at the same time. Some examples include calcium or magnesium and iron. Those are nutrients that are really attractive to some drugs. So instead of being absorbed into your bloodstream and going to work throughout your body, they'll bind with those in your stomach instead, hang out where they are, and you won't get the effects that you need from your medication. In order to avoid those types of situations, we usually separate the administration of medication from multivitamins or even dietary sources of calcium like milk to make sure that we give time for our body to absorb the medication and then also take our nutrients in later in the day so we get the benefits of both. Thank you so much for joining me today. Stay healthy.